The Senate will come to order. Senator Murphy.
Good morning, Mr. President. I impose the call of the Senate.
The Senate is now under call. Senator Murphy.
Mr. President, I move that further proceedings under the roll call be dispensed with and that the Sergeant-at-Arms be instructed to bring in absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members, will you be so kind as to stand? In our Senate tradition, we always start with prayer, and today's chaplain is Reverend Elijah McDavid III. He's from Fellowship Missionary Baptist Church in Minneapolis. As a gentle reminder, following the prayer, please remain standing for the Pledge of Allegiance.
Good morning, all. Would you bow and be in prayer with me? God, our Creator, Sustainer, and Redeemer, we come once again thanking you for the privilege of breath in our lungs, for the gift of seeing one more day. We choose not to take this day for granted, but instead to see it as a blessing, an opportunity to put our hands and our hearts to purposeful work. God, may your creativity anoint the minds of all who serve in this session. Endow our hearts with your values, compassion, generosity, forgiveness, and love. May you stir up the soil of our ingenuity so that that which we expected to be frustrating may turn out to be fruitful. And may every roadblock direct us to new pathways of clarity. God, may we see with new eyes as we look beyond our present interests and carefully craft legislation that will be a gift to our children and not a curse. We see this new day as a sacred opportunity to make right where we've made wrong, to be sensitive to realities we used to ignore, and to offer healing in communities that have been hurting for far too long. For when our journey comes to an end, our prayer is that you might be pleased with the labor and the dialogue taking place on this floor today. May your will be done here in Minnesota as it is in heaven. In the name of all that is healing and whole, we pray. Amen.
The Secretary will take the roll.
Abler, Barr, Bolden, Carlson, Champion, Clark, Coleman, Swadzinski, Dames, Dibble, Dornick, Draheim, Drazkowski, Duckworth, Farnsworth, Fateh, Frentz, Green, Grunhagen, Gustafson, Hochschild, Herr, Heinzman, Hemmingson Yeager, Hoffman, Holmstrom, Housley, Howe, Jasinski, Johnson, Johnson Stewart, Klein, Coran, Kroon, Kunish, Kupek, Lang, Latz, Liskey, Limmer, Lucero, Mann, Marty, Matthews, Mayquaid, McEwen, Miller, Mohammed, Murphy, Nelson, Umuver-Baton, Pappas, Pa, Port, Pratt, Putnam, Rarick, Rasmussen, Rest, Seeberger, Utke, Weber, Wiesenberg, Westland, Westrom, Wickland, Jean.
Members, a quorum is present. The following members intend to vote remotely pursuant to Rule 40.7. The senators are Senators Carlson, Coleman, Farnsworth, Fateh, Latz, Umuver-Baton, Pappas, and Port. Members, if you'd like to follow along, I'm reading from today's Senate agenda dated Tuesday, April 7, 2026. We will begin with the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to inform the Senate that the House of Representatives invites and is ready to meet with the Senate in joint convention at 6:45 p.m. on Tuesday, April 28, 2026, to receive the message of the Honorable Tim Walz, Governor of the State of Minnesota. Said message to be delivered at 7 o'clock p.m. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
I'll now call on Senator Murphy for a motion.
Mr. President, I move that the Senate accept the invitation of the House of Representatives to meet in joint convention in the House chamber at 6:45 Tuesday, April 28, 2026, to receive the message of the Honorable Tim Walz, Governor of the State of Minnesota.
Members, to that motion, all in favor, say aye. All those opposed, say no. The motion prevails. Members will now proceed to the fifth order of business, which is reports of committees. I'll call on Senator Murphy for a motion to adopt the committee reports.
Mr. President, I move the committee reports printed in the agenda be adopted with the exception of the reports pertaining to appointments.
On the adoption of the committee reports, all in favor say aye. All those opposed say no. The motion prevails. Senator Murphy for another motion.
Mr. President, I move that the committee reports pertaining to appointments be laid on the table.
To that motion, members, all in favor say aye. All those opposed say no. The motion prevails, members. Members, we'll now go to the sixth order of business for the second reading of Senate bills. The Secretary will read the number of the Senate file numbers.
Senate file numbers 3870, 3824, 2971, 1373, 4273, 3987, 3985, 3964, 4367, 3888, 3704, 3900, 4537, 4293, 4171, 2320, 4446, 4374, 4525, 4390, 2814, 281, 4543, 3295, 4520, 4652, 4406, 1857, 4006, 4223, 4760, 4366, 4496, 4168, 4660, 2061, 4177, 3685, 3959, 4874, 4555, 4301, 4206, 4379, 4294, 4703, 4602, 4735, and 476.
The Senate files have been given their second reading. Members will now go to the eighth order of business, which is introduction and first reading of Senate bills. The bills listed on today's introduction calendar are given their first reading and referred as indicated. There's an author motion to be read by the secretary. Members, before that, I've already indicated that the bills listed on today's introduction calendar are given their first reading and referred as indicated. We will now move to the ninth order of business. We will adopt the author's motion as one motion. And there's a motion to be read at the desk by the secretary.
Senator Johnson moves that the name of Senator Rarick be added as a co-author to Senate File number 3949.
Now that we have all the motions, we will adopt all the author's motion as one motion. All in favor say aye. All those opposed say no. The motion prevails. I'll now call on Senator Rest for a motion.
Mr. President, I move that Senate File number 3900 and general orders be stricken and re-referred to the Committee on Taxes.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Senate Resolution number 72 will be referred to the Committee on Rules and Administration. No action is required. Members remaining under motions and resolutions, I'm calling on Senator Murphy to designate special orders. Senator Murphy.
Mr. President, pursuant to Rule 26, I designate the following bills be made special orders for immediate consideration.
Members, the special orders list is on your desk, and we will begin with Senate File number 3769. Senator Klein.
Thank you, Mr. President. Thank you, Senators, for hearing Senate File 3769. Thank you for the support, guidance, and co-authorship of my bipartisan senators, Senator Mann, Senator Liskey, Senator Kupek, and Senator Dames. Members, every Minnesotan deserves access to care in their community, but right now our safety net health care providers and rural pharmacies are being undercut by drug companies ignoring federal law to keep their profits high. This bill today strengthens enforcement of Minnesota's drug pricing protections, which will keep hospitals open, protect patients, and require pharma to obey the laws. 340B is a program that may not be familiar to all of us, but it is simply a federal drug pricing program. It was established in 1992, and it requires drug pharmaceutical manufacturers to provide discounted drugs to our safety net providers. It supports care then for rural, low-income, and high-risk communities everywhere from Winona to Hennepin County Medical Center to Lake of the Woods. Hospitals use the savings to maintain access to care for Minnesotans, and no new taxpayer funds are required. But sometimes pharma doesn't follow the rules that the federal government has set. In 2020, Big Pharma began restricting these discounts and limiting hospitals to only one pharmacy in violation of federal law. For example, a community health center in the Northland may contract with several pharmacies to serve patients across a wide area, but when pharma ignores the law, individual Minnesotan patients are faced with difficult choices. They can travel farther for the medications they need, they can pay higher prices, or they can lose access entirely. In 2024, this Senate and our legislature attempted to solve this problem and answer this concern. We passed a Minnesota law to make it clear we expect pharma to honor its legal obligations. Despite this, Big Pharma is ignoring Minnesota law and denying Minnesotans access to lower-cost prescription drugs in their communities. The result is costing Minnesota's hospitals millions in savings that could protect patient care and ensure hospitals stay open, especially in rural communities. This bill simply adds enforcement tools to the bill we already passed in 2024 to ensure that Big Pharma follows the same rules in Minnesota as they do in other states. And in fact, it aligns Minnesota with 11 other states who have found this enforcement mechanism to be necessary for the drug pricing program. This includes both red and blue states, including North and South Dakota, Arkansas, and Mississippi. And in states like those with enforcement powers, Pharma does follow the law. In our state, they do not, because we don't have enforcement. This bill, besides adding enforcement powers, also removes the sunset date on our 340B legislation from 2024, which would provide long-term certainty for healthcare providers and make protections permanent to sustain access to care. This bill is not about changing the federal 340B program. Only Congress can do that. It is not about regulating what care patients receive. It is only about enforcing state law and protecting access to care, and our focus is on keeping our hospitals across the state open and pharmacies functional. Members, this is a David versus Goliath bill. This is Minnesota, Minnesota hospitals, and Minnesotans standing against Big Pharma and demanding that they honor their obligations under federal law to make sure we have access to affordable medications. Senators, stand with Minnesota, stand with Minnesotans, stand with our hospitals, and stand with the principle that when we enact laws in Minnesota, we expect them to be followed. I'll stand for questions.
Senator Rasmussen.
Thank you, Mr. President. I would agree with the bill author that 340B is an important program, and it's important for hospitals in the district that I represent and other hospitals across the state. But I think it's really important to set the table for what this bill is and what it isn't. The Minnesota legislature can't pass 340B into law, nor could we end it, because this is a federal program that, as a part of drug manufacturers participating with Medicare and Medicaid, they provide discounted drugs to hospitals who then have a markup on that and use that as revenue coming into their hospital. And even without Attorney General enforcement, the Minnesota Department of Health estimates that Minnesota hospitals in 1 year got $1.3 billion in 340B discounts. And so without Attorney General enforcement, we still have more than $1 billion a year coming through in 340B. It's also important to note that the sunset that this would repeal doesn't expire until after session in 2027. But, Mr. President, members, where does this money come from? Where does this $1.3 billion come from? And I want to point out that it just isn't free money. And in many cases, these dollars are coming from Minnesotans. Minnesotans are paying for this program. And you don't have to trust my word for it, Mr. President. Look at fiscal notes that have impacted 340B that has come from the Legislative Budget Office and the Walz administration, saying that hundreds of millions of dollars over time of taxpayer dollars are going to fund this revenue stream. You also have a letter on your desk that Senator Abler had distributed from a number of Minnesota trade unions who are saying that this program drives up their cost of health care for their members. And it's not just those trade unions, but it's small businesses, farmers, Minnesotans across the state are paying more when there is misuse in this program. We even have the report from the Minnesota Department of Health that talks about it is possible that drug manufacturers increase launch prices in response to offering 340B discounted prices, and that it can create drug affordability problems for patients. So that's where some of the money comes from. Mr. President, where does the money go? Thankfully, Minnesota has nation-leading 340B reporting that shows where these dollars are going to in terms of what covered entities. And I just want to talk about a couple in particular. Hennepin Healthcare receives about $100 million a year in 340B discounts. They also do $102 million in charity care. That's what this program was designed for, was to help out safety net hospitals like HCMC that are doing a lot of charity care. But if we look at Fairview, which gets 26% of the statewide revenue at one facility, they got about $335 million in revenue from this program, yet only did $17 million in charity care and paid their CEO $5 million. So we're seeing a disparity in terms of how this resource, which is granted under federal law, is used here in Minnesota, which has spurred the bipartisan interest in having transparency and reporting around this program. So the question for this body today isn't whether or not we're going to have 340B. We have 340B today. We had it yesterday. We'll have it tomorrow. This bill doesn't change that. The question is, are we going to give a blank check to hospital executives without needed transparency and program integrity that will protect 340B as a program long term? And so to address some of those deficiencies, Mr. President, I'd like to offer the A2.
Senator Rasmussen offers the A2 amendment. The Secretary will report the A2 amendment.
Senator Rasmussen moves to amend Senate File Number 3769 as follows. Page 1, delete Section 1 and insert. This is the A2 amendment.
Senator Rasmussen, anything else to your A2 amendment?
Thank you, Mr. President. The A2 does several things which would strengthen the underlying bill. Number one, it provides for more transparency. It would require reporting on how covered entities use the $1.3 billion in revenue that they get through this program. Second, it would allow basic program integrity and ensure that on outpatient drugs, we're able to ask, 340B participants are able to ask for information to ensure compliance with federal law, which will help reduce the risk of diversion in this program, which is against federal law. And then lastly, Mr. President, this would remove Attorney General enforcement and go back to the original bill that was passed a couple years ago. We don't need taxpayers becoming a private attorney on behalf of corporate hospitals here in Minnesota.
Senator Klein to the A2 Rasmussen amendment.
Thank you, Mr. President, and thank you, Senator Rasmussen, for your thoughtful concerns, which you have brought up repeatedly in committee and now here on the floor about the functionality of the 340B program. And as you pointed out, this is a federal program, and many of your concerns about the possible misuse of the intention of these funds should be addressed by our federal Congress and not by this Minnesota State Senate. But to the A2 specifically, I would say the following. First of all, the reporting that you suggest to the commissioner and to the legislature would add a tremendous fiscal cost to this bill and would put it out of order. In addition, these reports are already available. The Trump administration can ask for an audit from hospitals. The manufacturers of pharmaceuticals can ask for an audit from hospitals to make sure that the funds are being used appropriately. Going on to Section 3 of the A2, this would actually allow private pharmaceutical companies such as AstraZeneca to demand data from our hospitals like Hennepin County Medical Center or Winona Medical Center. They would have to turn over patient data to justify their use of 340B drugs to private drug companies. Members, this provision within the Rasmussen Amendment was so offensive to the legislature in North Dakota that they made it a misdemeanor. It is actually a criminal offense to do Section 3 of the A2 in the state of North Dakota. And lastly, members, removal of the Attorney General enforcement of this is gutting the entire intention of this bill. We've seen in states where there's no Attorney General enforcement of the bill that pharma ignores the law. In states where there is enforcement mechanisms, pharma obeys the law and hospitals get the money they need. I'm asking for a roll call, Mr. President, and I would ask the members to vote no.
Roll call requested, and a roll call has been granted. Any other discussions before we go back to Senator Rasmussen? He'll be the last voice we hear before we vote. Any other discussion? Senator Rasmussen, you're the last voice that they'll hear before we vote on the A2 amendment.
Thank you, Mr. President. And on this question of reporting, Minnesotans deserve to know transparency. There's a government program that's providing $1.3 billion in funding to Minnesota hospitals, some of which I think use this money very appropriately. to provide charity care, to provide access to rural health care. But others, Mr. President and members, are providing pennies on the dollar in charity care in terms of what they get and are paying their CEO $5 million. We should know, and Minnesotans should know, where these dollars are going. This is a basic reporting requirement that we should put into law. Second, if we do not adopt the language allowing for 340B participants to request claims data, there is no program integrity measures to ensure that federal law is being complied with. The federal agency, HRSA, that is charged with looking after this law, does very periodic audits. Within the last 15 years, only half of the 340B covered entities have had any type of audit from HRSA. This, in fact, is from CMS has said that by having claims data and access to claims data, you can reduce the amount of conflicts over 340B and ensure program integrity. And then lastly, Mr. President, on the AG enforcement, we hear from proponents of this bill that we need to have Attorney General enforcement to save 340B. Yet the Minnesota Department of Health just this year said with the latest year of data, hospitals got $1.3 billion in 340B discounts. And so I don't know how to reconcile that, Mr. President. But I think this amendment is a good faith attempt to strengthen the bill that's in front of the body, to make it more workable and ensure that we have program integrity for 340B going forward. I'd ask for members' yes vote.
The Secretary will take the roll on the A2 Rasmussen amendment. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pappas votes no.
Senator Pappas votes no.
And Senator Port votes no.
Senator Port votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Farnsworth votes aye.
Senator Farnsworth votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 35 noes, the A2 Rasmussen amendment is not adopted. Senator Rasmussen, for your next amendment.
Thank you, Mr. President. In the 340B report that was compiled by the Minnesota Department of Health on request of the legislature, one of the key items that they flag as a potential concern with this program are drug affordability problems for patients. And I'm just going to read briefly from this report so members know what I'm talking about. Because sharing discounts with insured patients who experience affordability problems decreases the amount of 340B revenue to the covered entities, there is a disincentive to provide discounted or free care to this group of patients. So what's happening, Mr. President, is that the hospitals, the covered entities, are able to sometimes purchase drugs pennies on the dollar for steep discounts, 40% discount, 60% discount or more. But then they turn around and charge patients the full list price, and they pocket the difference. And that can create affordability issues, especially for those who are uninsured or underinsured. And so to try to address that, Mr. President, I'd like to offer the A5.
Senator Rasmussen offers the A5 amendment. The Secretary will report the A5 amendment.
Senator Rasmussen moves to amend Senate File Number 3769 as follows. Page 1, after line 11, insert. This is the A5 amendment.
Senator Rasmussen, to your A5 amendment.
Thank you, Mr. President. This amendment would say that 340B entities cannot charge uninsured patients or patients covered by a high-deductible health plan more than what they pay for the drug under the 340B program. I'd ask for member support and request a roll call.
Roll call requested. Roll call granted. Senator Klein to the A5 Rasmussen amendment.
Thank you, members, and thank you, Mr. President. Thank you again, Senator Rasmussen. Once again, Senator Rasmussen valiantly is attempting to correct a federal program here in the Minnesota State Senate. If there are alterations that need to be made to ensure that the 340B program is functioning appropriately, that it is not overcharging uninsured or underinsured patients, those need to be directed to our federal Congress. It is not our job or really our purview here in the Minnesota State Senate to make those alterations. I will say that that gap between the cost of low-cost medications that hospitals and clinics and rural hospitals pay and then the reimbursement that they are able to obtain from insurers or from public programs, et cetera, is precisely the mechanism that was designed by the 340 program 30 years ago to ensure hospitals had a revenue stream to sustain their operations for low-income patients. So I oppose the A5 amendment, and a roll call has already been requested. I ask for a no vote.
Members, before we go to Senator Rasmussen for his last comments, I want to go to Senator Nelson, and then, and we have another. Senator Nelson.
Thank you, Mr. President. Senator Rasmussen, I appreciate the effort here. I think we all appreciate the effort of trying to hold down the high cost of medicine, medical care in general, and we know that prescription drugs are often the biggest driver of the increases that we see in health care. So I definitely appreciate the point that you are making here. And I specifically am reminded of something that many of us have worked on for a long time, which is share the rebates. This amendment gets to, in a sense, how should those rebates be shared? And quite frankly, we are finding that often it is the insurance companies that claim the rebates instead of the patients that are paying the bills. And I do believe that is a major problem. And in fact, it was the understanding of how in the world, I'll tell you what led me to the share the rebates thing. I was trying to understand how could it be that insurance companies put the highest cost drug on the formulary? It doesn't make sense. Everybody would have to pay more. Well, the answer was there were huge rebates to put the higher cost drug on the formulary. That was the start of my share the rebates drive. And so, Senator Rasmussen, while I definitely agree with sharing the rebates, I want to know how your amendment, which requires that, I want to know how that would affect critical access hospitals. Our critical access hospitals are operating on thin margins, if not many outright deficits. And I want to know how this amendment would affect critical access hospitals' ability to keep serving their patients, because you're taking away the funding for the rebates, which I would like it to go to the patient, but I think you're taking it away from the critical access hospitals. I want to know how that would impact them and their ability to serve.
Senator Nelson, I didn't hear you ask for Senator Rasmussen to yield. Are you asking for Senator Rasmussen to yield?
Thank you, Mr. Chair. I believe he heard my comment, and I would ask that he yield to answer that question.
Senator Rasmussen, will you yield? He will yield. Senator Rasmussen, specifically to Senator Nelson's question. Thank you so much.
Thank you, Mr. President. Thank you, Senator Nelson, and for your comments and work on drug affordability in Minnesota. This amendment would only pertain to uninsured patients or patients who are covered by a high-deductible health plan. So the hospitals, for the majority of their patient base, would still be able to realize that spread on the 340B pricing and get the revenue. However, if this amendment doesn't go on, this bill and change how 340B operates in Minnesota, we will be taking dollars out of the pockets of uninsured Minnesotans of Minnesotans who have high deductible health plans and giving it to the hospitals. And I think Minnesotans that are uninsured in our state or who are paying a $5,000, $10,000 deductible, I think we should be putting their interests first, and we should be prioritizing patients, and that's what this amendment would do.
Senator Nelson, any more questions before I go to Senator Holmstrom?
Thank you, Mr. President. And just one final question. Certainly understand that logic, and if Senator Rasmussen would yield for one final question.
Senator Rasmussen, will you yield? He will yield. Senator Nelson.
Thank you, Mr. President. So, Senator Rasmussen, then my question really does get to those critical access hospitals, and do they support this, or do we know, and is there a danger that they may not be viable then to serve any patients?
Senator Rasmussen, specifically to Senator Nelson's question.
Thank you, Mr. President, and thank you, Senator Nelson. I don't have a survey in terms of where all the hospital executives are on this. I think overall the hospital executives have said that they want to have as much 340B revenue as possible, right? And so this would be prioritizing Minnesota patients who are paying out of pocket ahead of what the hospital executives are asking us to do. But I will state that there are covered entities, including those that came and testify in one of our Senate committees, that do this already, that basically understand that one of the purposes behind 340B was to help patients afford their health care. And so this, I think, would be aligned with the stated intent of 340B and aligned with what some hospitals are already doing today.
Senator Holmstrom.
Thank you, Mr. President and members. I rise in support of this amendment. I think that it gets to the heart of one of the greatest issues that Minnesota has faced, which is affordability in health care. My family's been uninsured. My family has been a member of a high deductible health care plan, and I can tell you these people are not there because they choose to be. They are there because they have no other financial option. Trying to force hospital profitability on the backs of uninsured and underinsured Americans and Minnesotans is certainly not the answer to our problems. If we want to address those, I would recommend finding a different way. However, Senator Rasmussen's amendment, I believe, does right by the people of Minnesota across all partisan lines. They will see their lives get just a little bit easier in this affordability crisis. Thank you.
Senator Grutenhagen, we're on the A5 Rasmussen amendment.
Okay. Thank you, Mr. President. Yeah, I rise in support of the amendment. You know, members, it's important to understand why we're in this situation and why hospitals are using the 340B plan as a measure to generate additional income. The primary reason, and this is to understand, the Minnesota hospital lobbyist invited me to a Zoom meeting with about 6 CEOs, a couple from the metro area and 4 from the rural area, a couple years ago. And in there, they all said the same thing. They were hurting financially. Of course, we know about Hennepin County Medical Center here. But they brought up several things that caused them to have the problems and want to use the 340B program to generate additional income. One is the reimbursement rate of government programs. So on Medicaid, for every $2 of expenses, and all 6 of them said the same thing, they get $1 of reimbursement. So they lose money. On Medicare, they get about $1.50. And by the way, with Medicaid, it also includes Minnesota Care. On private insurance, they get about $2.50 for every $2 of expenses. So they actually make money. The problem is they're seeing, under Obamacare, they're seeing more and more government reimbursement where they lose money, less and less private sector insurance. On top of that, you know, the promises of Obamacare were false. These high deductible plans that are out there, what's happening, according to the hospital lobbyist, people are not paying that $5,000, $7,000, $8,000, $10,000, $12,000 deductible. So they're losing money as much or more than they did before. In addition to that, we see the uninsured rate climbing dramatically. We're just shy of 6%. Which is actually higher than before Obamacare when we were about 4%, if I remember right from the HHS committee. So members, this is forcing hospitals to manipulate and abuse this program. And again, we're talking about high deductible plans and low income people not being abused if we accept this amendment. They're not collecting the money anyway. Okay? We're just putting these people through the ringer. Why not give them the advantage of a lower drug, which many of them desperately need, at a more reasonable price? Again, the making of the unaffordability of health care is our own, okay? Not individuals. And that's why we're forcing these hospitals to want to use this 340B program for a money generator. And in some, not in all cases, but some of the hospitals are doing this to keep their doors open. Last point is, Senator Hochschild sent a Mesabi Tribune article around, and it basically confirms everything I just said. It basically said rural hospitals, if they don't make use of this 340B program, are in danger of closing their doors. So members, we're again at the point where we're dealing with a Band-Aid rather than the infection. The infection is the reimbursement rate of government programs and the direction we're taking this state, which this program is not going to solve this in the end. So let's help the people who need it, the low-income people or the high-deductible people. Again, if it's not excluding everybody, but we need to treat the infection. By the way, I have a bill to do that. Unfortunately, I can't get a hearing on it, but that's another story. Anyway, so members, please vote green on this amendment. It's a step in the right direction to help the people that we truly want to help, that all of us want to help here at the State Senate. Thank you, Mr. President.
The last voice that we'll hear is from Senator Rasmussen before we vote on the A5 Rasmussen amendment. Senator Rasmussen.
Thank you, Mr. President. And I thought that the bill author made an interesting comment where he said, yes, acknowledging that there might be deficiencies with 340B and how it operates, that we should wait for Congress to act and to take changes to 340B. However, the bill before the body ignores the bill author's advice. It is saying that this legislature will intervene on behalf of hospital executives and what they want us to do, but we're told no when we have the opportunity to put Minnesota patients first who are paying more money out of pocket for prescription drugs than they have to. And by adopting this amendment, we can make sure that the intent of 340B, which is to have access for uninsured patients, for underinsured patients, that principle is met. I would ask for member support.
Members, a roll call has been requested and a roll call has been granted. The Secretary will take the roll on the A5 Rasmussen amendment. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. I might be waiting on one here, but let's go with what we have. Senator Carlson votes no.
Senator Carlson votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pappas votes no.
Senator Pappas votes no.
And Senator Port votes no. Votes no, sorry.
Senator Port votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Mr. President. Senator Farnsworth votes aye.
And Senator Farnsworth votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 32 ayes and 34 noes, the A5 Rasmussen amendment is not adopted. Senator Rasmussen, for your next amendment.
Thank you, Mr. President. It's unfortunate today that Senate Democrats were unwilling to put Minnesota patients first and the costs that they are seeing in terms of health care. And so I want to, Mr. President, give them another opportunity with the A3 amendment.
Senator Rasmussen offers the A3 amendment. The Secretary will report the A3 amendment.
Senator Rasmussen moves to amend Senate File Number 3769 as follows. Page 1, after line 6, insert. This is the A3 amendment.
Senator Rasmussen to your A3 amendment.
Thank you, Mr. President. And this is taking language that had bipartisan support in this body that would prohibit hospitals from charging facility fees in certain instances. First, they would not be able to charge it for telehealth, that is when the patient is outside the facility. And second, they wouldn't be able to charge a facility fee on preventative items that are defined here in state law. Again, this is an opportunity, Mr. President, to put Minnesota patients first and help them afford the health care they need.
Senator Friends.
Thank you, Mr. President. I'd like to raise a point of order.
Please state your point of order.
Mr. President, I think this amendment, the A3, is not germane to the underlying bill, and I would ask that the President rule that it is not germane. And
advice.
That's Rule 35, and I'd also request a roll call, Mr. President.
Roll call requested, roll call granted.
Advice, Mr. President.
Members, I will take advice from Senator Rasmussen, and then we will vote.
Thank you, Mr. President. Advice on the Senator Francis' point of order. This amendment would be amending the exact same section or chapter of law that the underlying bill amends. I think this is perfectly germane. I know there's nothing in the underlying bill related to affordability, so that might be a reason why it's not germane, but I think when you look at the contents of the bill and the title of the bill, this is a germane amendment.
Thank you. The Friends' point of order is well taken.
Mr. President, I appeal the ruling of the President and request a roll call.
Roll call requested, roll call granted. Members, a green vote supports the ruling of the President. Red vote goes against the ruling of the President.
Mr. President, advice to the body.
Senator Rasmussen.
Thank you, Mr. President. Thank you, members. Well, I know there's nothing in this bill that would make health care more affordable for Minnesotans. I would ask you to overturn the ruling of the President and vote red so that we can have something that puts Minnesota patients first. Thank you, Mr. President.
The Secretary will take the roll on the appeal of the decision of the President.
Mr. President.
Senator Rasmussen, for those voting pursuant to Rule 40.7.
Senator Zinsky, but I'll also give the vote. Senator Coleman votes no.
I'm sorry, Senator Jasinski.
Senator Coleman votes no.
Senator Coleman votes no.
Senator Farnsworth votes no. Thank you, Mr. President.
Senator Farnsworth votes no. Senator Westland? For those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Umu Verbatim votes aye.
Senator Umu Verbatim votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
And Senator Port votes aye.
And Senator Port votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There have been 35 ayes and 31 noes. The decision of the President is upheld. Senator Gruenhagen for your amendment.
Oh, thank you, Mr. President. You know, members, we talked about transparency. We talked about some of the abuse that with some hospitals. We don't want to say blanket statements. There's a lot of people trying to do the right thing as far as the 340B program is concerned. But my particular amendment targets a particular area. It's the A4. I'd like to offer the A4, Mr.
Senator Gruenhagen offers the A4 amendment. The Secretary will report the A4 amendment.
Senator Gruenhagen moves to amend Senate File Number 3769 as follows. Page 1, after line 11, insert. This is the A4 amendment.
Senator Grudenhagen, to your A4 amendment.
Well, thank you, Mr. President. Yeah, members, what this amendment would do, it would prohibit using 340B funds for gender identity or gender expression or gender mutilating surgery. So you could not use it. Now, members, I know we have difference of opinion on this here, but there's been recent legal rulings, like in New York, that have struck down and given major financial rewards to minors who went through this gender surgery at a young age. I think it was $2 million in the New York case. The other thing, members, the reason I think you should vote for this is, members, we all know that we've had problems with the federal government freezing funds because of our fraud and because of a number of other reasons. And the thing is, I have advocated in the HS committee, hey, we want to help the people who really need help. I think everybody here wants to do that. Well, in order to do that, we have to cooperate with the federal government. You know, in the previous presidential administration, I had a lot of disagreements with them on issues. But I would not try to advocate anything that would allow the freezing or loss of funds. You know, I was invited to attend the Finance Committee last year, and they shared that each year Minnesota gets about $22.9 billion of federal funding, members. Think about that. Each year we get about $22.9 billion of funding. The thing is, we know with Medicaid, and because we've shown resistance towards cooperating with the federal government in some of this fraud, that CMS was freezing over $500 million of Medicaid of federal Medicaid funds for the state of Minnesota. That's over $2 billion, members. And I know there was a lot of angst about that in terms of how are we going to help the people who really need it. Members, I know we have disagreements with the current administration, some of you do, and some of it very strongly. But members, I had strong disagreements with the previous administration, but I would never take a stand and support things that would lose federal funding for those most needy. That doesn't mean we don't address the fraud and a host of other things, but to do that, we need to cooperate. So members, this is an area, if we go down this path and the federal government discovers you're using this federal program of 340B money for gender transitioning on minors, you're going to see the loss of federal funds. That's what's going to happen. They're going to be frozen, or they're going to have lawsuits that are going to cost millions of dollars. So regardless of your position on gender-affirming care, the least you should want to do is add this amendment so that we don't see a withholding of the federal funds for the people who we want to help that desperately need it. So, members, I ask for a roll call, and I would ask for a green vote. Thank you.
Roll call requested. Roll call granted. Senator Friends.
Thank you, Mr. President, and thank you, members. Mr. President, I wish to raise a point of order under Rule 35. I believe the amendment is not germane to the underlying bill. Mr. President, we have a bill simply seeking to provide enforcement of existing federal law, and to bring gender-affirming care seems to define things that are not germane to the bill. So I ask members, I ask you to rule that the amendment is not germane. Thank you, Mr. President.
Mr. President, advice.
Senator Rasmussen.
Mr. President, advice. This amendment is very germane. If you look at the title of the subdivision, it says 340B revenue prohibited use. It's pertaining exclusively to 340B covered entities. This is a bill about 340B. This amendment is germane. The underlying bill has commercial restrictions on what can take place under 340B. And we are just adding an additional one on how that revenue can be used. No different than my amendment earlier in the debate today, talked about how hospitals had to engage with their patients given the 340B discounts they have. This says what they can use the revenue for. I would ask that you find the point of order not well taken.
Senator Grudenhagen, you'll be the last voice before I rule.
Oh, thank you, Mr. President. Yeah, advice to the body. I believe this is germane for the reason Senator Rasmussen just said. But members, we're talking about hospitals. We're talking about a particular procedure that hospitals could do. Now, again, a lot of them have prohibited it, but it just was reported by NPR yesterday that Children's is going to start up again. And again, they're going to endanger federal funds to the state of Minnesota. We don't want that. Again, regardless of your position, we should at least vote on this and send a message that we want to cooperate with the federal government. It is germane for the reason Senator Rasmussen said, and it's a medical procedure in our hospitals. And it's going to endanger federal funding, including some of the 340B money, if the federal government finds out about it. So members, please vote no, and let's have a recorded vote on this amendment. Thank you, Mr. President.
The Friends' point of order is well taken.
Mr. President, I appeal the ruling of the President and request a roll call.
Roll call requested, roll call granted. Members, a green vote supports the ruling of the President, and a red vote is in opposition to the ruling of the President. The Secretary will take the roll. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Umu Verbaeten votes aye.
Senator Umu Verbaeten votes aye.
And Senator Port votes aye.
And Senator Port votes aye. Senator Marty, are you voting? Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes no.
Senator Coleman votes no.
Senator Farnsworth votes no.
And Senator Farnsworth votes no. All senators having voted who desires a vote, the Secretary will close the roll. There being 34 ayes and 32 nays, the decision of the President is upheld. Senator Liskey.
Thank you, Mr. President. Mr. President, this bill before us is definitely of an urgent nature for our hospitals, especially those in rural communities that rely on 340B funding. The issues that we face with this bill is there's some opposition, and some pretty strong opposition for lots of different reasons. And we've heard about transparency, we've heard about enforcement and things like that. And so with that, I offer the A6 amendment.
Senator Liskey offers the A6th amendment. The Secretary will report the A6th amendment.
Senator Liskey moves to amend Senate File Number 3769 as follows. Page 1, delete Section 1. This is the A6 amendment.
Senator Liskey to your A6th amendment.
Thank you, Mr. President. Mr. President, the A6 amendment strictly removes the enforcement side of the equation at this time because I believe there are multiple different ways that this could be enforced. I do not believe the Attorney General's office is necessarily the best option, being that he is definitely working on a lot of areas, and I think this would only burden his list of things that he's enforcing more so. With that being said, I think the Department of Commerce may be a better route to go for enforcement. We could offer a lot of different options, Minnesota Department of Health, DHS. All of those things could have a better impact on enforcement. And so with that, I think just extending and removing the sunset gives us time to discuss what the best line of enforcement would be, and we could come back and debate that at a different date.
Senator Klein to the A6 Senator Liskey amendment.
Well, thank you, Mr. President, and thank you, Senator Liskey, and actually thank you again for supporting this bill as a co-author, and I think it will have an immediate and beneficial effect on hospitals in Northfield, and I would be quite concerned that they would be, I think they would be in opposition to the A6 amendment. We've seen in states that don't have a firm enforcement mechanism that pharma continues to disobey federal law. Certainly we've seen that continue to play out in Minnesota In states that have inserted significant enforcement mechanisms, pharma has immediately complied. This is urgent, as you said, and this is the correct way to do this, get this into law immediately so that we can continue funding streams to our hospitals, which have never been in such dire straits in my experience of 35 years of practice. Members, I urge you to vote no on the A6, and I request a roll call.
Roll call requested, roll call granted. Senator Westrom to the A6 Liskey Amendment.
It was all knotted up, Mr. President. Sorry for the delay, my cord. Mr. President, I'm wondering if the author of the bill would yield to a question.
Will you yield to a question? He will yield to a question. Senator Westrom.
Mr. President, Senator Klein, you referenced you've seen several instances of drug companies not complying here in Minnesota. Could you share with the body which drug companies they are and what are those violations, just so we can all be aware of what's going on in our state?
Senator Klein to the question from
Mr. President,
Westrom.
Senator Westrom, I don't have that information in front of me.
Senator Westrom.
Mr. President, Senator Klein, you don't have any of that information? We just use that as an argument to not support this amendment. I would like to know who are the drug companies that have been violating the law, and why are they violating it currently if we know they're doing it? And you just represented to the body that you've seen in many instances that to be the case, and that was your reason to compel the body to vote no on this. And so could you get the information if we laid this over for a little while, Senator Klein, what you just represented to us? I would like to know who those drug companies are. Let's deal with it right here on the Senate floor so we can have them follow the law that we already have on the books here in Minnesota, if you would yield to that question.
Senator Klein, will you yield?
I will.
He will yield. Senator Klein to the question.
Mr. President, Senator Westrom, no, I don't have that information immediately in front of me with the details of which specific pharmaceutical companies have been guilty of this. I do know it to be a fact, and I encourage you to work out with your research staff to find the specifics on that.
Senator Westrom to the A6 Liskey Amendment.
Well, Mr. President, Senator Klein, you are the one that brought it up here. You said you knew, and now we find out you don't know. So, members, I would urge your support of the Liskey Amendment, using information that you really don't know as a reason to say someone in the Senate should vote no on an amendment is troubling to me. Senator Liskey, I don't know if you know any of that information. I'd offer you the opportunity when I sit down to give us that, but you're not the one that said it, so I'm not going to put you on the spot. But members, why are we debating with information that we don't have, representing to the Senate that you have it and you know it, and then getting up and saying you don't know it? This bill doesn't look like it's ready for prime time. This amendment certainly would help us give more time to figure that out. The Department of Commerce seems like a very logical place to do this enforcement. That's who enforces a lot of insurance and other law already in our state. And I don't know why the hospitals couldn't enforce this themselves when the law is on the books. And so, members, I would urge your green vote. It troubles me that we are told to vote no because of information that's going on, and yet we can't get the information because the author of the bill wouldn't know it. I'm troubled that he would represent that to us and then find out we don't know it, because I would like to know what drug companies are violating this law so we can stop it here in the Senate, and by calling them out would be a good first step.
Senator Jasinski.
Thank you, Mr. President. Would the author of the bill stand for question?
Senator Klein, will you yield? He will yield. Senator Jasinski.
Thank you, Mr. President. Thank you, Senator Klein. So just a question, and maybe I missed it. So this is obviously giving more powers to the Attorney General to enforce these. Is there a fiscal note? How much will this cost our Attorney General's office to enforce this new enforcement policy? Or What's the fiscal? Is it $1 million? Is it $10 million? What's the estimated cost of our Attorney General to enforce this?
Senator Klein, to the question.
Thank you, Mr. President. Thank you, Senator Jasinski. There is a fiscal note which I will have the staff distribute now, and our finance chair can speak to it if you wish. It is entirely absorbed by the Attorney General's office.
Senator Jasinski, any other questions?
Thank you, Mr. President.
Members, we're on the A6 amendment. Before I let Senator Senator Liskey have the last word, any other discussion? Seeing none, Senator Liskey.
Thank you, Mr. President. Senator Klein, thanks for your comments on Northfield Hospital. I believe all hospitals are really worried about 340B as a whole disappearing. I don't believe that the enforcement side of the equation is as necessary, especially because we don't know for sure that the Attorney General would be the right place for that enforcement. And so with that, I still urge a green vote on this bill, on this amendment, and look forward to your support. Thank you very much.
The Secretary will take the roll on the A6 Liskey amendment. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
And Senator Port votes no.
And Senator Port votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Mr. President. Senator Farnsworth votes aye.
And Senator Farnsworth votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 35 noes, the A6 Liskey amendment is not adopted. Senator Abler.
Well, thank you, Mr. President. I'll offer the A50 amendment.
Senator Abler offers the A50 amendment. The Secretary will report the A50 amendment.
Senator Abler moves to amend Senate File Number 3769 as follows. Page 1 after line 11, insert. This is the A50 amendment.
Senator Abler, to your A50 amendment.
Thank you, Mr. President. I admit this may broaden the focus of the bill, but if it's about helping hospitals, at least I'd like a chance to describe it, and then we can haggle about if it's germane or not. But the HCMC and our safety net hospitals are fundamentally important to the welfare of our state, and they are at risk. I hear over and over that HCMC is going to close in June if we don't do a 1% sales tax. Mr. Chair, I don't even think that's a reasonable idea to add another 0.85 onto the Minneapolis nightlife or to the vendors there who are already struggling and property values are going down. So I think we need to find a better way. And this is my very crude option, very crude start to the discussion in a public way. I read in the paper the only plan is that one. And so I know people are working on things, Mr. President, but this is something that's concrete that says we had better weigh in. And so there's three parts to this in the ways it would help actually every hospital that takes any large amount of Medicaid. One is it would increase the rebasing, which is the rates that we pay for Medicaid, which are years behind and are part of the reason for Hennepin counties and North Memorials and Regions and Alina and those companies that take a lot of Medicaid clients, and they should be able to be paid for what they do. They can't work below cost forever. The second is this suspends the hospital surcharge for 2 years. It doesn't make sense to subsidize a company that you're actually taxing. And so it's like a 1.2% or so, and it's worth about $230 million in the first year. Now, this would need to be fleshed out, and this bill is going to go wherever if it happens to go on, and I'm not sure it will go on today, Mr. President. But it's a discussion we need to have as a Senate to create a Senate position. How are we going to help these folks? There's talks about uncompensated care pools. There's talks, community benefit. There's talk about that we really need them to stay around. But I think the message of this amendment I'm suggesting from my point of view is this is important to every Minnesotan. And I think while we shouldn't be spending much money at all, this is a place to dip into the till as a state and decide how are we going to stabilize our hospital industries across the state. Not just in, the Northfield we talked about, Mercy, all and up in wherever, greater Minnesota, St. Cloud. It's that big of a deal. And so, and then finally, for HCMC, as I chatted with them, they could use some flexibility. And so what they're allowed to do in this amendment is that between the management, which is the commissioners, and the MNA, if they unanimously agreed to something, which is a high bar, then they would be allowed to get a waiver from the Department of Health. I can't give you an example that would be specifically, but I do know that the people that are leading the place and the nurses are very interested in patient safety and quality care and all of that. So, Mr. Chair, I don't know that this bill is ready, but I wanted to bring it forward today to tell the people in Minnesota who have heard only the 1% idea, which I don't think it'll pass this body, and I would gamble less than 1% chance to pass the other body. So I'm putting my effort into it and my commitment to help this happen. And Mr. President, I don't see anybody stand to talk, and I don't want to belabor the discussion, but this is really important. And without this, Mr. President, the industry, if HCMC closes, the load cannot be absorbed, or if the rest of them go. So we'll keep working on it. Mr. President, with that, I would like to withdraw my amendment. Thank you.
Senator Abler withdraws the A50 amendment. Senator Murphy, I saw you standing. Did you still want to speak? No? Okay. Any other discussion on the 3769 before we go to third reading? Seeing none, the Secretary will give the bill its third reading.
Senate File Number 3769, a bill for an act relating to health care continuing to disallow drug manufacturers from restricting delivery of 340B prescription drugs.
Third reading. Any other discussion? I think I had Senator Kupek on the list.
Thank you, Mr. President. I'm very proud to support this bill. It's a very simple bill. It's only a few lines long, but it is critically important, and here's why. It's a godsend to those rural hospitals, like ones in my district, because they're facing incredible challenges. Just for the hospital in Detroit Lakes alone, this is a huge part of their being solvent in Detroit Lakes. As a member of the Health and Human Services Committee, I've sat through many committee hearings this year. We've examined what's going to happen in rural health care, and the news is sobering. H.R. 1 made deep cuts in programs like Medicaid, which has a bigger impact in rural communities and areas where Minnesotans rely on these programs for their care. We're talking billions of dollars in cuts, which will mean fewer services, bigger workforce issues, and ultimately less care. That's why it's important we do everything we can to help our rural health care partners, and that's why we're going to do this today. It's not about politics. It's about making sure people can get the care that they need. We need enforcement of measures that have real teeth and that will make pharma face consequences if they don't follow the law. We can do this because in states where they have those tools to enforce the law, pharma follows it. Look no further than across the river from me to North Dakota. They're one of the many states, red, blue, purple, that have these measures in place. Minnesotans deserve those same protections. This is a good bill. It protects access to care, especially in rural areas, and it holds big pharma accountable. I strongly urge your support for this bill.
Senator Hochschild.
Thank you, Mr. President. I rise as a representative or a senator from a rural district, and it's in fact the most rural district in the state. I represent communities where there isn't always a backup hospital down the street, where it's often that you can't find another pharmacy across town, where if something closes, it's not just an inconvenience, it's a crisis. And right now, that crisis is staring us right in the face, because the 340B program is one of the last real lifelines keeping rural health care standing in places across greater Minnesota. And let's be honest about what this program is. It was created to help hospitals that serve a disproportionate share of Medicare and Medicaid patients to keep their doors open. Because here's the reality. Those programs don't pay the full cost of care. So rural hospitals are left trying to do more with less every single day. 340B was created to help fill that gap so that they can keep emergency rooms open, keep pharmacies operating in rural towns, and essential services available regardless of your zip code. That's what this is about. And yet today, we have pharmaceutical companies openly disregarding Minnesota law. Not bending it, not debating it, ignoring it. Let's be clear, this isn't a fair fight. On one side, you have rural hospitals, local pharmacies, and patients in rural communities. On the other, you have some of the most profitable corporations in the world. U.S. pharmaceutical profits in the U.S. exceeded $100 billion last year. Hospital margins are often between 1% and 5%. And in fact, 40% of rural hospitals are operating in the red. At the very same time, we have the federal big, beautiful bill, which is an oxymoron, putting more pressure on healthcare. Cutting Medicaid, shifting costs onto states and our counties, and squeezing the exact hospitals that we're talking about today. So let's get this straight. Some of the same folks who support the big, beautiful bill are now saying we shouldn't enforce the very programs that were created to provide the gap funding for rural hospitals in greater Minnesota. That doesn't add up. And here's what should concern everybody. Big Pharma is spending enormous amounts of money to confuse average Minnesotans. The estimates are $1 million a day. We've heard a lot of discussion about how we could discount costs for local patients. Well, my question is, why doesn't Big Pharma take the millions of dollars they're spending on ads to confuse average Minnesotans and provide discounts to those patients? Seems pretty easy to me when you have $100 billion in profits. If they were on the right side of this issue, they simply wouldn't need to try to muddy the waters with ads. You know, in 2023, we passed a PBM reform bill. And at the time, Big Pharma spent millions of dollars in ads against senators like me. And the problem was they put the ads on billboards in Minneapolis and St. Paul. I don't know how many of you know, but I represent the Iron Range in northern Minnesota, not Minneapolis-St. Paul. So the ads seemed really odd to me. But when you have hundreds of billions in profits, I suppose you can spend money on billboards anywhere you want. And the funny thing was, I had a family member in the Twin Cities see the billboard. And she decided for Christmas she would play a little joke, and she had one of those little mini billboards created with the ad and gave it to me for Christmas. Well, I proudly displayed that billboard in my office because I will always stand with patients and rural hospitals over Big Pharma. So my question today with this is, what is the next billboard that Big Pharma will have in Minneapolis and St. Paul targeting me and trying to take me out? Members, this debate is very simple. Do you stand with patients and hospitals, or do we stand with the pharmaceutical companies trying to avoid accountability on Minnesota law? Recently in my district, we had a little roundtable with community leaders in Lake County. And a rural hospital leader stood up in front of everybody and said, if we don't remove the sunset on 340B, if we don't add enforcements to the 340B program, rural hospitals will close. Let me repeat that. A rural healthcare leader said, if we don't remove the sunset on 340B, add enforcement language, and ensure that Big Pharma is paying their fair share, rural hospitals will close. And once a rural hospital closes, we know they don't come back. This bill is simple. It removes uncertainty. It simply enforces existing Minnesota law, and it ensures that Big Pharma plays by the same rules as everybody else. And other states have done this. Blue and red states. There's not a distinction. This isn't partisan. Other states have done this to ensure that their laws are followed. So I'll close with this. I'm proud to be the senator from the most rural district because I know firsthand what's at stake. This is about whether people have care close to home. So we can stand up today and we can protect it, or we can stand with Big Pharma and continue to dismantle rural health care just like the federal government has with the big, beautiful bill. I know where I stand. I hope you do too. Thanks.
Senator Grudenhagen.
Well, thank you, Mr. President. Yeah, Senator Hochschild, I share the same concern about rural hospitals. I've listened to my hospital. I've lost a hospital in my district that had to close. And again, the problem is low reimbursement of government programs. That's the problem. And Obamacare just made that exponentially worse. And by the way, the single-payer plan that the Democrats have proposed in the state of Minnesota is going to reimburse doctors and hospitals at a lower rate than Medicaid or Minnesota Care. So again, this is a Band-Aid. It doesn't treat the infection. And members, one of the things that we have to understand, when we let millions of illegals into this country unvetted, that either have no care or they're on Medicaid, they exasperate the problem. We need legal immigration. But we can't, to just open the borders like the last administration did was a disaster. And it overtaxed our system and aggravated the problem. So, Senator Hochschild, if you care about rural hospitals, you should support legal immigration, well vetted, and have illegals go back to their country under a program. I think they get $2,600 of free flight, and they can come back here legally. And we get rid of the criminals and the illegal drugs and the crime and a host of other things. So that's the solution, not a Band-Aid on infection. So you and I have the same goal about rural hospitals. The problem is we're not treating the real problem. We're simply languishing in it, and we're going to continue to go down a road where you're going to see rural hospitals close or hurt financially. And here we even have Hennepin County Medical Center. Again, the last administration just opened the doors to flood our country. And again, we need legal immigration. We're all children and great-grandchildren of legal immigrants. So again, we convolute it. As far as the drug prices and the drug companies, I agree. They've exploited Americans. And this bill tries to take a step in that direction. But it's the wrong step. This administration, Trump, came out with Trump RX to actually bring drug prices down. He's doing something. The last administration did absolutely nothing. They just let the drug companies go wild. And under Obamacare, the drug companies supported Obamacare because they could fleece the system. So please think through the problems. Putting Band-Aids on infections doesn't fix the infection. Ultimately, it gets worse. And unfortunately, to trust the AG, which has a record of not investigating fraud, not dealing with it, and in some news reports actually accepting money from fraudsters, I don't think is the right step. We should go with the Commerce Department or even independent enforcement rather than with the current AG. So members, please vote no if you want to deal with the problem rather than just put a Band-Aid on the problem and still see more rural hospitals closed down the road. Unfortunately, that's where this bill's taken us. Thank you, Mr. President.
Senator Westrom.
Thank you, Mr. President. Would Senator Hochschild yield?
Senator Hochschild, will you yield? He will yield. Senator Westrom.
Mr. President, Senator Hochschild, you brought up, too, the drug companies have been not following this law in Minnesota. Can you identify 2 drug companies to us on the Senate so we know who we are passing this bill to help enforce?
Senator Hochschild, to the question.
Thank you, Mr. President. Thank you, Senator Westrom. If I might, yes, I can go through the list. AbbVie, Amgen, Astellas, AstraZeneca. Apologies if I mispronounce some of these. They're a little challenging. Maybe that's obscure for a reason. Bausch and Lomb, Bayer, Boehringer Ingram, Bristol Myers Squibb, Alsea, Eli Lilly, EMD Serrano, Exlexis, GeneTech, Gilead, Insight, Jazz Pharmaceuticals, Johnson & Johnson, Mitsubishi Taniba Pharma America, Novo Nordisk, Pfizer, Sandoz, Sanofi, Sobi, Takeda, Teva, UCB, and Viatris have all been involved in that.
Senator Westrom.
Mr. President, Senator Hochschild, continue to yield.
Senator Hochschild, will you continue to yield? He will yield. Senator Westrom.
Mr. President, Senator Hochschild, thank you for that list. Can you explain to us what you know about what they have all done that has violated the law here in Minnesota, the length of the list you listed?
Senator Hochschild, to the question.
Thank you, Mr. President. Thank you, Senator Westrom. They're simply not following the 340B law here in Minnesota.
Senator Westrom.
And so, Mr. President, Senator Hochschild, if you continue to yield.
Senator Hochschild, will you yield? He will yield. Senator Westrom.
And so, Senator Hochschild, why has this been allowed to happen and nobody goes after the violators if there's a violation, or is this just an allegation and it's really not occurring? Because it seems crazy to me that everybody would be violating the law on your list. Apparently, many people know they're violating it, and nobody does anything about it. I'm a little perplexed yet, so can you explain a little bit more why they haven't went after these companies? If hospitals have been violated, they've got a very large state organization. They could contract with a lawyer quickly and get this resolved. Why haven't they done that if it's a violation of the law that's so clear and obvious as you've just explained to us?
Senator Hochschild, to the question.
Thank you, Mr. President. Thank you, Senator Westrom. There have been several civil cases that you can look up with regards to this, but the problem is we need this enforcement language to help enforce the law.
Senator Westrom.
Mr. President, Senator Hochschild, thank you for that answer. Vague as it is, members, I don't think this bill is ready for prime time. We've had multiple amendments to improve it. The author didn't even know the list of drug companies. When I asked him, Senator Hochschild just read us off a list, but it seems like everybody knows there's violators, but there's nobody willing to go after them. There might be some gray area in between here that isn't very clear, and that's the part of the committee process. That's part of the legislative process to clean this up. This bill seems like it's not ready for prime time, and we need to do some more work. And if that many drug companies are flagrantly violating the law here in Minnesota, they've just been called out. Department of Commerce is who enforces a lot of these situations between insurance and other medical companies that are licensed to sell and do business here in Minnesota. Members, let's send this back and get it right. I'm not convinced that this bill is ready for prime time. Unfortunately, we could make it much better so it would actually target what we're trying to get it to do. And so at this point, I don't think I can support it. I wish it wasn't so haphazard that's being put in front of us to vote on something that we know is not ready for prime time.
Senator Dames.
Thank you, Mr. President and members. Ensuring the stability of our health care safety net is a critical issue in the quality of the life of the greater Minnesotans. How far should people in greater Minnesota have to drive to see a specialist? How far should they have to drive to deliver a baby? The 340B program plays a vital role in helping our rural hospitals keep their doors open. It prepares essential funding for emergency departments, labor and delivery services, ambulance operations, and basic payroll. Hospitals are preparing their budgets and operational plans for the next years ahead. They need certainty that the 340B program will remain available and stable. That's why we must lift the sunset on the program before we adjourn this year, so our hospitals can coordinate and work together and develop their budgets for the future years. Also, Mr. President and members, I believe that we also need to strengthen the enforcement of the Minnesota laws and make sure they're enforced. Thank you, members, and I'd encourage a green vote.
Senator Jasinski.
Thank you, Mr. President. Would Senator Hochschild stand for a question?
Senator Hochschild, will you yield? He will yield. Senator Jasinski.
Thank you, Mr. President. Senator Hochschild, you commented about all the pharmaceuticals and all big pharma that are having all these issues and all these conditions and lawsuits, and yet we have a fiscal note that says the Attorney General office will absorb a cost of $36,000. Given all those companies and all the infractions and all the view that there's going to be more infractions and more enforcement, do you believe $36,000 is an accurate number for this Attorney General office to look into all these issues?
Senator Hochschild to the question.
Thank you, Mr. President. Thank you, Senator Jasinski. I'll let the fiscal offices determine the fiscal note, not me.
Senator Jasinski.
Well, thank you, Mr. President. Senator Hochschild. So in the fiscal note, there's some assumptions that are pretty important here today. It absorbs the first year of $36,000, but it says the Attorney General office will absorb that work needed for the time being. Once we have experienced reviewing the number of complaints submitted and the amount of work needed to deal with those, any enforcement actions, we'll need to come back to the legislature for increased funding. And given the names that you rattled off and all the issues that you and Senator Klein said there is, I believe there's going to be a much higher fiscal cost coming back next session. Again, if you read the assumption, only $36,000, and that's a pretty small amount for what we're looking at in this bill. Thank you.
Senator Pratt.
Thank you, Mr. President. Mr. President, this bill has been a difficult one for me. I don't spend a lot of time looking at healthcare issues. I do support the 340B program. It's been in place now since the early 90s and has helped our rural hospitals in a number of ways. However, the main part of this bill is removing a sunset, and removing that sunset a year and a half early. The sunset was put in place for a reason, because we had questions that needed to be answered. Mr. President, I was looking at the Minnesota Department of Health report that was issued just a little over a month ago. And what they say is that between the first report and the second report, we gained a lot of insight, but there are still some very, very important questions that need to be answered. How do covered entities use these revenues generated through the 340B program? I haven't heard that answer. To what extent do those revenues reach patient populations? For context, what are the net revenue margins for covered entities on non-340B outpatient drugs purchased through group purchasing organizations? And Mr. President, I think one of the most important ones, what factors have contributed to the growth of the 340B program, and to what extent can their individual impacts be measured? Mr. President, here we are, removing a sunset, giving the Attorney General some additional powers, and yet we don't have answers to these very, very important questions. The report also says, while this 340B initiative is an important step towards greater understanding of how safety net services are supported, transparency alone cannot resolve the broader complexities in the current healthcare system. We don't know what's driving the cost. We don't know what's driving the impact. There's a BRG report that suggests that we might be losing out on $40 million in reimbursements that would normally be coming through and are now falling on the laps of Minnesota taxpayers. Senator Klein, I fully support the 340Bs, and I think we need to make sure that these drugs are available. But I want to know how that money's being used. I want to know What are the factors that are driving up the cost and driving up the usage? And through the entire committee process, I've not heard answers to these questions. Members, we've heard a lot about whether or not this is a bill that's ready to be passed. And I think this legislature would be wise to wait until next session. Wait till a year from now. Let's get answers to these questions. Let's figure out, we should be looking at how can we answer these questions, not rushing to judgment on eliminating a sunset that we put into place to ensure that we had the very answers and to make an informed decision. Mr. President, I'm concerned. I have many concerns with this bill, and I hope, Mr. President, I really hope that the majority will take a serious look at establishing a process for getting these questions answered. Thank you.
Members, I want to make sure there's no one else because the last three speakers will be Senator Rasmussen, Senator Murphy, and Senator Klein. If you've spoken already, I've given you an opportunity to speak. Anyone else that has not spoken? With that being said, Senator Rasmussen.
Mr. President, parliamentary inquiry.
State your inquiry.
Mr. President, you just said if we spoke, we can't speak again. Can you cite what rule that is under Mason's or Senate rules?
There's no rule there. We have a practice where we go to, once everyone's had a chance to speak, we try to make sure of that. And so we will then go to Rasmussen, Murphy, and then Klein.
Parliamentary inquiry, Mr. President.
Senator Westrom.
So, parliamentary inquiry, Mr. President. If somebody hears somebody talk about something on the floor and has spoken already, is the rule under the Senate rules and Masons that they cannot speak or follow up with any questions after another person has raised different debate in a bill passage?
There is,
and if so, where's that rule, Mr. President?
Usually under special orders, we do not have such a rule as far as limits, but we do if it's not under special orders. But we have custom where if there is, everyone's been given an opportunity to speak, we always go to who's been the main minority architect for the arguments as well as the others. But not to prolong us, Senator Westrom, I hope that you'll keep your comments brief, and to whatever issue that you believe was stated that you did not have an opportunity to hear, because I did not hear any additional arguments before or after you spoke. Senator Westrom.
Mr. President, respectfully, that is not your position to decide, and I appeal the ruling of the chair and ask members to not concur with the President's interpretation of our rules. And I ask for a roll call.
Senator Westrom, I take that as you just wanting to say something because I haven't made a ruling. In fact, I recognize you to speak. So do you want to speak or do you not want to speak?
Mr. President, I had to raise a parliamentary inquiry to get you to answer the question. Mr. President, you gave the answer that you said you will decide it because I've already spoke and it's a custom. I don't believe it's a custom, and I'm appealing your decision that you told me and getting the body to weigh in on whether we speak one time or not. Because it's not in our rules, I would ask you to proceed with the vote.
There's nothing before the body. I'm trying to explain that to you. There's nothing between the body. There's been no ruling that you cannot speak. I have recognized you, and it just appears to me that you just want to argue at this point. So would you like to speak? Senator Westrom.
Mr. President, are you relinquishing your prior statement and allowing somebody to speak twice if they've already spoke once on this?
Senator Westrom, I'm not relinquishing anything, but
then
I am recognizing.
Appealing that decision, Mr. Chair.
Excuse me, Senator Westrom. Now, I'm not going to keep going around with a debate with you. I have recognized you, and if you want to speak, you can speak. So we are asking you to speak so that we can go on. That's why I'm recognizing you, even though we have a custom that we have been adhering to. So, Senator Westrom,
Mr. President,
this is the last time. Senator Westrom, you are recognized to speak.
Mr. President, you are making a much bigger issue out of something today that I never expected to hear nor even discuss today. But, Mr. President, I have been here many years. You have been here many years. It is not in our rules that somebody can only speak once on a bill, and then you go to the final authors to speak. If there's other things they want to debate, it is a Senate custom that many times people can speak 2 or more times on an issue of concern, and it concerns me greatly that you just told us that it's your custom to only have us speak once on an issue, and then you're going to go to the last 3 speakers that are on your list. That is the issue I am very concerned about, greater concern than I even on this bill. But, Mr. President, it's on video, it's on record what you just told the body, and that is what I'm challenging your decision. Because it was a decision you were trying to convey to the body. I had a simple question and discussion I was going to bring up, and you were excluding that with some imaginary rule because it's not in Mason's and it's not in our Senate, because I raised a parliamentary inquiry because maybe I missed it. And you told us it wasn't in there. It was a custom only under your presidency, because under your presidency, we even have a custom of people speaking twice on a bill and not just limited to once. And that's a dangerous precedent for us to go down, and I'm concerned the way you represented it to the body, and I don't want that to happen again. And that's why I'm appealing your decision or ruling, and I'm asking you to inform us if that's going to be the way you're going to continue to proceed as president or not.
Senator Westrom, are those your comments? Because if those are your comments, then you're using your time in order to go around and around. I recognize you. There's nothing before the body other than you have been recognized. Would you like to speak to the bill, Senator Westrom?
So,
and
Mr.
if you have something
President,
else that you want to say,
thank you for amending your custom then, because I am going to speak twice on this bill, even though you tried to cut me off.
Sounds good, Senator Westrom.
So, Mr. President, we're setting new custom here, and I hope we take note of that. But, Mr. President, members, Senator Jasinski brought up this fiscal note. We've all been given this information. Senator Hochschild, it troubles me greatly to have the list you read to us. The author of the bill should know that list, and we should be a little suspect of our fiscal note of only $36,000. Members, that is how government grows out of control. That is how government has fraud upon fraud that they can't find, because they pass bills that say something's only going to cost $36,000 to the taxpayers and the legislative branch. And you and I all know if Senator Hochschild's list of pharmaceutical companies violating state law is only going to cost $36,000 to bring a lawsuit and compel them to follow the law, those things don't square. This is a bunch of phony baloney. Phony baloney is what we're going to pass at $36,000. There's either not the exaggerated problem that Senator Hochschild talked about, or it's real and it's not going to cost only $36,000 of attorney fees and costs to bring multiple lawsuits to multiple companies that were just read on the Senate floor. Members, I revert back to my point. This is not ready for prime time. We should not be duped by a fiscal note that on its face is phony baloney if the facts we're being told are as accurate as they assert them to be. So, members, it's not ready for prime time. This bill needs more work, might have a good spirit or intention. The sunset doesn't go away for a year and a half, just about. We have a whole other legislative session, and we have 6 weeks about left in this session that we can still pass this bill, but it needs to be ready for prime time and not full of phony baloney as we try to pass it on the Senate floor. I urge a no vote at this time. Let's get our facts right first. Make sure a fiscal note is not ripe for fraud or a huge bill down the road. Let's get facts and accurate numbers from the Attorney General's office and not think we're going to bring that many lawsuits if there's that much violation for $36,000, because that won't cover the cost of one lawsuit, and you and I all know that.
Again, members, anyone else that would like to speak before we go to Senator Rasmussen, Senator Murphy, and then the bill author? We want to make sure that you've had an opportunity to speak. Seeing none, Senator Rasmussen.
Thank you, Mr. President. 340B is an important program, and we know that by looking at the report from the Minnesota Department of Health that shows that it generated about $1.3 billion in revenue for 340B eligible entities. But that occurred before this bill was implemented. This bill won't change what happens to 340B. It's a federal program with federal rules that has federal compliance. Unfortunately, we had opportunities today to make real reforms, to make sure that 340B works for Minnesota patients and not just hospital executives. Unfortunately, the Senate Democrats rejected an opportunity to improve transparency into how these 340B dollars are spent. And that's important, Mr. President, because if we look at the Minnesota Department of Health's report, they would say that there's mixed evidence on whether 340B benefits patients directly. And I'll just quote from the report. Several peer-reviewed studies of hospitals participating in the program find little to no increase in safety net care provided after covered entities begin participating in the program. That's why we need the transparency, so that when we have Fairview Hospital, who gets $335 million from this program, they only do $17 million in charity care, and they pay their CEO $5 million, we can look and have accountability about how these dollars are being spent. Second, we tried to put patients first and patient affordability, making sure that uninsured Minnesotans and those with high deductible health plans could benefit from the lower cost drugs that the hospitals are buying through 340B. But that was rejected. We prioritized hospital executives over Minnesota patients on this floor. We also are ignoring the questions from Minnesota employers, from trade unions, from taxpayers who want to make sure that their dollars are going where they should. We also had an opportunity to enhance program integrity, to ensure that the covered entities are complying with federal law, but that too was rejected. And so, Mr. President, I support the 340B program, but only if we make the reforms that ensure that these dollars help Minnesota patients and not just hospital executives. And I worry that the bill currently today is a blank check to those hospital executives, and we can ask more for the dollars that they're getting under this bill. And so that's why I'll be voting no.
We now go to Senator Murphy before we go to the author of the bill, which is none other than Senator Klein, before we vote. Senator Murphy.
Thank you, Mr. President, and thank you, colleagues, for a wide-ranging debate today on what Senator Klein has proposed, which I think is a fairly simple, straightforward, and elegant solution to a very significant problem that Minnesotans are facing, and that is where they're going to get their health care and how they're going to pay for it. We have watched a Congress pull the thread on a health care system that we have relied on and built upon for many, many years. They are driving up costs for Minnesotans for the cost of their insurance, and many of them are now abandoning their insurance coverage because they can't pay the premiums. We know that with the suffocation, if you will, of financing mechanisms like provider taxes and surcharges, the ways in which we have partnered with the federal government to pay for health care systems across the state, that we are left with fewer and fewer solutions while Minnesotans are finding it harder to get care, particularly in rural hospitals. But if we look around, we can see that our healthcare delivery system is showing real signs of trouble. And I have to imagine today that as Minnesotans listen to this debate, they perhaps wondered if we were thinking much about them at all, as this debate was wide-ranging and not necessarily on Minnesotans and what they are experiencing because of an unraveling of the Affordable Care Act, an unraveling of a partnership with the federal government, and its impact on healthcare delivery across the state of Minnesota. I want to call out Senator Abler for his withdrawn amendment. And this amendment didn't belong in this bill. But this amendment is a serious swing at a serious problem that we have to address this session, and that is HCMC. And where I agree with Senator Abler is just putting more money into HCMC without dealing with the governing mechanisms and without dealing with understanding its impact in relationship to our hospitals across the state. We are not doing our job. When we passed Minnesota Care so many years ago, before any of us were here, there was a gang of 7 that brought the final solution. Members of the House and the Senate, Democrats and Republicans, who decided to do the work of the people and not spend time in the chamber just debating about our opposition to ideas. And if we don't leave this session this year with a short-term, at least, solution to HCMC and a plan to build the system for the people of Minnesota going forward, including serious minds in this body and across the way, we are not doing our job. And Minnesotans will be let down by us because they will not get the care that they need for their health and their lives. We've got 6 weeks left. 6 weeks. This is a primary issue for us. It is a priority. It's an imperative. And I was grateful to see the work of Senator Abler on this floor. I am grateful the work that is happening in Health and Human Services and taxes to try and address and bring a solution forward. I think it is the Senate that is going to find its path, and a path for HCMC. And we might not meet the request of HCMC and the county board, but we're going to find a path forward for that hospital and for the hospitals across the state of Minnesota. Thank you very much, Mr. President.
For what purpose do you rise?
I rise to a point of order under Mason, Section 101.
Will you state the point of order, Senator Lucero?
Thank you, Mr. President. Debate must be confined to the question before the body. Everything that Senator Murphy said in her remarks had nothing to do with the bill. Other, perhaps important ideas that can be debated, but nothing, in fact, related to the question before the body. I would ask you to remind Senator Murphy to debate the bill that's actually before the body. Thank you.
Members, as a friendly reminder, under Section 92 of Mason's, interruption of members speaking when permissible. A member who is speaking may be interrupted only when some motion requires immediate consideration. I've been very very considerate of the number of different people who have sometimes not always adhered to the motion or the business that is before the body. I'm going to remind the body, if you would be so kind as to be measured when it comes to your comments, okay? Senator Murphy, you were finished? Okay. All right. But that is a good time just for us to be gently reminded. So emotions, I've heard today a number of people go off and talk about immigration and other things, and that wasn't the point. I want us all to be considerate and thoughtful when it comes to these things, because it will help the body focus, and even for the public who's listening. The last voice that we'll hear is that of the author, Senator Klein.
Thank you, Mr. President. Thank you, members, for the debate. I want to speak briefly about the concerns raised about the fiscal impact of this bill, because I think that is an important responsibility of the Senate in particular. And I want to assure members that in other states that have created enforcement mechanisms around 340B, they have experienced zero costs, and that is simply because of the deterrence factor of instituting Attorney General enforcement leads to compliance by the pharmaceutical industry. Other members on the floor have asked how these funds are being used. And I have to say I chuckled at that a little bit. I would encourage those members to go talk to their hospitals, talk to the nurses, and talk to the doctors, and talk to the social workers, and talk to the addiction medicine specialists. Of the people on this floor, I think only Senator Bolden and I have spent our lives walking the halls of hospitals and hearing those people and watching their work, and we know very well and in a very heartfelt way how these funds are being used and how desperately needed they are. I do hear the concerns from the amendments offered by Senator Rasmussen about shifting costs onto uninsured or underinsured patients. I do hear the concerns from our labor unions about increasing premiums because we are trying to hold down costs for our hospitals. I do hear the concerns of Senator Abler that we should be desperately trying to do something for Hennepin County Medical Center in this state. And I will just simply say that it is terrible that we as a society are forced into these decisions between one ailing entities such as our hospitals, our beloved hospitals, and the people among us who don't have health insurance, or the working families who can barely afford their premiums. We can do better, and we will do better, but we cannot sacrifice one of these entities for another. There is one factor, there is one player in the healthcare delivery system who is doing extremely well, and that is pharmaceutical manufacturers. And we simply cannot continue to allow them to avert and shirk their duties to provide low-cost medications to our patients and our hospitals in this state. Members, I worked my last shift at a hospital after 35 years on February 1st. It was beloved work and very close to my heart. But I have never seen our hospitals in this state in such a situation of crisis, and it is only going to get worse. If, in fact, $1 trillion in medical assistance cuts roll out as anticipated over the next year, hospitals will close, rural hospitals will close, urban hospitals will close. And today we have the opportunity to hold off that storm for one more day, to continue this funding stream of 340B medications to our hospitals all across this state and say we did this in this moment and we did right. Members, I urge a green vote, and thank you for your support.
Almost fell. All right. Seeing that, and I want to just assure you that they didn't push me. And I could get back up. That's right. The Secretary will take the roll on final passage of Senate File 3769. Senator Westland, for those who are voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Umu Verbaeten votes aye.
Senator Umu Verbaeten votes aye.
And Senator Port votes aye.
And Senator Port votes aye. Senator Jasinski, anyone voting under or pursuant to Rule 40.7?
Thank you, Mr. President. Senator Coleman votes no.
Senator Coleman votes no.
And thank you, Mr. President. Senator Farnsworth votes aye.
Senator Farnsworth votes aye. Senator Duckworth, are you going to vote? Senator Curran? All members having voted who desires to vote, the Secretary will close the roll. There being 42 ayes and 24 noes. The bill is passed and is titled agreed to. Members, we will now proceed to the 13th order of business, which is announcements of Senate interests. Any announcements of Senate interest? Senator McEwen.
Thank you, Mr. President. I just wanted to announce to the members that the Senate Labor Committee will be meeting promptly after we are done here.
Senator Kunesh.
Thank you, Mr. President. Members, I would like to remind you and invite you and your staff to join us this evening at the Gnome Craft Pub on Selby Avenue from 5 to 7 o'clock and get a preview of the the 80th annual Minnesota Midwest Legislative Conference. That conference is being held here in St. Paul, August 30th to September 2nd. So please join us this evening at the Gnome to get a little preview of what that's going to look like. Thank you.
Senator Rest for tomorrow's event. Senator Rest for tomorrow's event.
Thank you, Mr. President. Everyone is invited to celebrate the opener of the Minnesota Twins. They actually opened last week with an amazing game, and we hope that you will join us in celebrating that victory over in the MSB. The hosts are Senator Champion, the President of the Senate, and myself. Thank you very much.
Senator Dibble.
Thank you, Mr. President and members. Mr. President, members, the President has threatened the whole civilization will die alongside threats to target civilian infrastructure across Iran, actions that would constitute war crimes and violations of international law. What we are witnessing, Mr. President, from Donald Trump is not just reckless rhetoric, it is a stated willingness to destroy an entire people. So let us be clear. Threatening the annihilation of a nation's civilian population is the language of genocide. It is illegal, it is immoral, and it is profoundly dangerous, not only to innocent lives abroad, but to the rule of law and the integrity of our own democracy.
Mr. President, point of order.
For what purpose do you rise?
This is a point in the agenda where we are doing Senate interest, points of Senate interest. This does not seem to be pertaining to the business today of the Senate. Wondering if Mr. President would be able to remind members to stay within the agenda.
Give me one moment. Members, I just wanted to make sure I was conferring with the Secretary. It is true that under 13th order of business, it's announcements of Senate interest just around Senate business. So I know that sometimes we have sometimes gone afoot of that, but that is correct. So, Senator Dibble.
Well, Mr. President, I would just say that I think history is watching. So are the people who are sworn to serve. I think they'll be very interested in understanding that the leader of the other party tried to stop discussion on the day that the President of the United States has called for the genocide of an entire country.
Members, we're on the 13th order of business, and just so that we're clear, you all, there seems to be a couple things that's going on today that I just want to be very forthright about. Number one, it is true that we sometimes have people who stand, and even if we're talking about motions, they seem to go outside of the bounds of motions. Please adhere to rule, I believe it's section 101, where it says that whatever you're discussing has to narrowly be around what is before the body. I know that people have interpretations because they have very creative ideas as to how to make everything apply, but I ask that you will be thoughtful about that. So that would be very helpful. And then also under the 13th order of business, let's keep it right where it is. Senator Westrom.
Mr. President, would Senator Dibble yield for a question?
Senator Dibble, will you yield for a question?
Mr. President,
he says yes. Senator Westrom.
Senator Dibble, I was just trying to be clear. Are you standing with the Iran regime under your announcement? Is that what we're to take away from your announcement?
I want us to be careful because, again, this goes to the very issue of what we should be talking about versus what we should not. But since you asked him a question, I will allow him to respond.
Thank you,
Senator
Mr.
Dibble.
President. Mr. President, no president who openly contemplates such acts as genocide of an entire country is fit to command our armed forces. So I call on Congress and on members of the Cabinet to uphold their constitutional duty to act immediately through the legal means they have available to remove this president from power before irreversible harm is done. Thank you, Mr. President.
Senator Westrom.
Mr. President, thank you. I'll take that as a yes.
Senator Weissenberg.
Thank you, Mr. President. So today is April 7th, and this does pertain to Senate business, hopefully this year. It's International Beaver Day today. So I'm hoping that today we can actually get the law to, not today, but this year, we can actually make it legal to eat nuisance beavers, because there are people in my district that's literally how they feed their families, and in Minnesota now, they can't legally do that. Thank you, Mr. President.
Any other announcements of Senate interest before we go to Senator Murphy? Any other announcements of Senate interest? Seeing none, Senator Murphy.
Mr. President, I move that the Senate do now adjourn until Thursday, April 9th at 11.
On that motion, all in favor say aye. All that opposed say no. The motion prevails. The Senate is now adjourned. Senator Johnson.